Hello and welcome to a new edition of DTV. We're really delighted today to have Canon Pattillo. He is head of data science for Hello Porter. Hello Porter is a health science platform that uses data science to deliver better healthcare outcomes for people. And we're going to learn a bit more about that now from Canon. Canon, welcome to the program.
Hey, thank you, Avery. I'm happy to be here and certainly thank you for including me. I appreciate it.
Canon, you've got a really interesting story about why you came to Porter and the kind of the difference it's made in your life. And I think a lot of people would appreciate a little bit of insight about all of that.
Yeah, absolutely. So my wife and I have two lovely little girls. Normally when I'm in my office, it's one of the first things folks see behind me. And our youngest was born with hip dysplasia. And it's not that unique or rare, but a lot of kids resolve that issue fairly quickly. Unfortunately, our journey with our youngest has been a little longer. So we started off in a harness. We moved to 5 non-surgical operations where she was casted from her armpits down to her ankles. And those are really scary, especially for a parent, as your 8-week-old baby, or I guess in that case, she was closer to 12 weeks, 14 weeks, going under anesthesia. That's really scary. And, over time, her right hip resolved, but her left hip still has some issues. And she's 19 months now. And she's running around now. She doesn't know anything's wrong, but we're still not out of the woods yet. And while we were going through that, the stress was amplified being the parent of a little girl going through an issue like that. And I remember my wife turning to Facebook, looking through all the online communities to see if, there were any other families out there going through something similar. And I don't know about you, but I don't want to get my get input on my healthcare journey or that for my daughter from Facebook. It was hard to understand what equipment we needed. Little kids, they still poop, they still pee. You've got to change diapers. You've got to keep these babies clean. And we ended up procuring a lot of equipment ourselves. I remember setting up a changing table out of a folding table you'd buy from Home Depot, just because that's how her cast fit. She didn't fit in a normal changing table, didn't fit in a car seat. And we didn't really have anywhere to turn where we could help connect the dots between what our doctor was telling us, how we could keep our baby healthy, what we needed to do next, what was okay and not okay. It was really stressful. And I know that Porter, if Porter were there for me then, we would have had one place that we could have gone to get the equipment that we needed, the education that we needed. We could have talked to folks about the journey we were on. I just hope that I can be a part of providing that place for parents in the future and other people.
So one of the things that I think you call it the health sphere, that a lot of the challenge people have is how to get information from peers or people who have kind of walked that trail before, without exposing necessarily everything about their lives to the whole world. Is that the kind of thing we're talking about?
That's right. One of the data challenges that we have is earning the trust of our members, and that's just native to being a healthcare company. We want to be able to understand who our members are and where they are on their journey, what type of troubles they have, activities of daily living. Do they have issues getting in and out of bed? Do they have issues getting on and off the toilet? Some of these things can get very intimate, but if you want to address the problem, then the more information that we can share back and forth, the better. And one of the ways that data science helps us scale is, for less complicated cases, we can come up with some logic and we can come up with some things that make sense, some product bundles, some education and other things. But then one of my favorite stories, I believe it's from Berkeley, is I believe when they built their campus, they didn't pour any sidewalks. They wanted to see where where students tread, and then whatever period of time later, as the students, ruin the grass through certain areas in the campus, then they poured their sidewalks. And we're doing something similar at Porter. So as we see for what conditions and demographic combinations that people are purchasing for the education that they're viewing and the partner services that they're leveraging, then we can understand those journeys a little bit better. And frankly, better than how you could understand those journeys if you were just interpreting claims data, because there aren't any uncovered items on claims data. So it's pathways through our platform that help us scale and meet people where they are on their healthcare journey.
And so the key is you give people the insight from peers, you analyze all of that data, some of which is from claims, some of which is more self-disclosed. And then through that, try to give people insight about what could make a difference for them.
Oh, absolutely. There are challenges and opportunities in data all throughout the healthcare space. We're not just leveraging claims data or the pathways through our platform to help folks. We're bringing in partner services that are solving problems across the spectrum of social determinants of health needs. That's whether someone has access to the right nutrition, or does someone have access to transportation in order to get to and from their healthcare team and appointments. We are leveraging data from outside the healthcare space, really. As you think about organizations for uncovered products that might be helpful, that's Nielsen and other folks like that. We're also trying to leverage less traditional data assets like admission, discharge, and transfer, ADT feeds. And how can we scale those feeds that are somewhat immature now to meet patients where they are, so that we understand when one of our members is admitted to the hospital, how can we help them almost immediately while they're just starting their new journey, whatever that might be. So how do we maximize those ADT feeds? How do we help them in near or real time understanding ER capacity, where they are? Should they even be at the ER, or could they go to an urgent care down the street? We want to get to that level of detail and that level of engagement for our members. And then another data asset, as payers and facilities begin to adopt new regulations around price transparency, how can we leverage that information to help folks understand, one, through eligibility and benefits, where are they on their cost sharing journey? What supplemental benefits do they have access to that they might not know about? But then also begin to help them estimate the cost of their care, not only for the procedure part, that's interesting, but we want to help them understand the cost of their care for covered and uncovered items, not only financially, but also from a time perspective as well. So, when I was in that journey with my daughter, I know that I would have sacrificed dollars in order to get the equipment that I needed faster, for example. And we want to give people the right information so they can make those decisions for themselves while they're in that journey.
So one of the challenges in a lot of healthcare situations is, by definition, you or someone you love is not at 100%, or you wouldn't be needing healthcare.
Yeah.
And usually, or often, time is of the essence.
That's right.
That time is a huge factor. And it sounds like what you're helping people do is use the data science to tell them both what are the critical decisions coming up, some of which they may not even be aware of, and then also what's been other people's experience with that same decision and consequences downstream. Is that a good way to think about this? Yeah,
that's very fair. Now, we could go into a much longer conversation about how you moderate communities. I mean, that's a problem that Facebook and Twitter have been dealing with for a very long time. But we want to give folks access to other members And beyond that, our healthcare professionals, both inside our communities and then our care guides, to help give them input from other people who have experienced similar arcs of care. You can leverage historical claims to do something similar. And so as we harmonize these data assets and these features of our platform, we're giving people a sense of comfort, because for some of these arcs of care, they're well tread. They may be short, they may be long, but in some cases they're well documented, and in other cases they're not. And whatever the case may be, we want to give them whatever information we have access to in order to help, again, just ease that arc of care.